From self-driving cars to personalized shopping recommendations, artificial intelligence is rapidly changing the world around us. But what about its impact on our health, specifically our mental health? In this video, we're diving deep into the intersection of AI and mental health, exploring the groundbreaking innovations that have the potential to reshape how we understand, diagnose, and treat mental health conditions. Join me as we uncover the exciting discoveries, weigh the potential benefits and drawbacks, and examine the ethical considerations of this rapidly evolving field. Imagine a future where diagnosing mental health conditions is faster, more accurate, and less reliant on subjective interpretations. This is the promise of AI-powered diagnostic tools. Researchers and tech innovators are developing sophisticated algorithms that can analyze various data sources, such as speech patterns, facial expressions, and even social media activity, to detect subtle signs of mental health conditions like depression and anxiety. Think about it, our voices often change when we're feeling down, our facial expressions might betray our inner turmoil, and even our online interactions can offer clues to our emotional state. AI can pick up on these nuanced changes that might not be immediately apparent to the human eye or ear. This early detection is critical, as it allows for timely intervention and potentially prevents these conditions from escalating. One of the most exciting aspects of AI in diagnostics is its potential to overcome the limitations of traditional methods, which often rely heavily on self-reporting and clinical observations. These traditional methods, while valuable, can be influenced by various factors, including a patient's willingness to be completely open about their symptoms, recall bias, or even the subjective interpretation of the clinician. AI, on the other hand, can analyze vast datasets objectively and identify patterns that might not be easily recognizable to humans. This can lead to more objective and consistent diagnoses, ensuring that individuals receive the appropriate care they need. Close your eyes for a moment and imagine stepping into a serene forest, the gentle sound of a flowing stream calming your mind, or perhaps finding yourself on a beach, the warm sand between your toes, the rhythmic sound of the waves washing away your worries. Now, imagine accessing these tranquil settings from the comfort of your therapist's office or even your own home. This is the potential of virtual reality therapy, or VR therapy, cutting-edge approach that is transforming how we treat mental health conditions, particularly those like PTSD, phobias, and anxiety disorders. VR therapy, powered by AI, allows individuals to immerse themselves in virtual environments tailored to address their specific needs and fears. For someone struggling with social anxiety, imagine practicing social interactions in a simulated coffee shop or a crowded networking event, all within the safe and controlled environment of VR. This allows individuals to confront their anxieties head-on, gradually building their confidence and developing coping mechanisms in a way that feels real but without the high stakes of real-world interactions. What makes VR therapy particularly powerful is its ability to evoke realistic sensations and emotions. Imagine, for instance, a soldier suffering from PTSD being able to revisit the scene of a traumatic event in a controlled virtual setting. This allows them to process the trauma in a therapeutic environment, gradually desensitizing themselves to the triggers that cause them distress. The beauty of VR therapy lies in its ability to create personalized experiences, adapting to the user's responses and providing tailored support throughout the therapeutic journey. This level of personalization, coupled with the immersive and engaging nature of VR, makes it a game changer in the field of mental health treatment. In the realm of medicine, data is power. The more we understand about a patient's medical history, lifestyle, and genetic makeup, the better equipped we are to develop personalized treatment plans tailored to their unique needs. This is where AI's ability to analyze vast amounts of data comes into play, revolutionizing how we approach mental health care. Imagine a world where AI algorithms can sift through mountains of patient data, including medical records, genetic information, lifestyle factors, and even environmental influences, to identify patterns and predict an individual's risk of developing certain mental health conditions. This predictive power is invaluable, as it allows for early intervention and preventive measures, potentially altering the course of someone's life before a condition even manifests. Think of it like this: if we can identify individuals who might be predisposed to developing conditions like depression or anxiety, we can proactively offer support, resources, and interventions that can help mitigate their risk. This could involve lifestyle modifications, stress management techniques, or even early counseling, all aimed at preventing the onset of more severe symptoms. But AI's role in data analysis goes beyond just prediction. It can also help us understand the effectiveness of different treatment approaches. By analyzing data from countless patients, AI algorithms can identify which therapies have been most successful for individuals with specific characteristics, such as their age, gender, genetic background, and symptom severity. This data-driven approach to treatment selection ensures that patients receive the most effective interventions right from the start, minimizing trial and error and maximizing their chances of recovery. With any transformative technology, especially one that deals with something as sensitive as our mental health, it's crucial to address the ethical considerations. Privacy concerns are paramount. Think about the sheer volume of personal data that AI algorithms rely on: our deepest thoughts, our vulnerabilities, our fears. Ensuring that this data is handled responsibly, securely, and with the utmost respect for patient privacy is non-negotiable. One of the key challenges is striking a balance between data access and data security. For AI algorithms to be effective, they need access to large datasets to learn and make accurate predictions. However, this access must be carefully controlled and regulated to prevent unauthorized use or breaches. Imagine the potential consequences if an individual's mental health data fell into the wrong hands. It could lead to discrimination, stigma, or even exploitation. That's why it's essential to establish clear guidelines and regulations regarding data encryption, storage, and access. Another ethical consideration is the potential for bias in AI algorithms. AI is only as good as the data it's trained on. If the datasets used to train these algorithms contain biases, these biases can be amplified and perpetuated. For instance, if an algorithm is primarily trained on data from one demographic group, it might not be as accurate in diagnosing or treating individuals from other groups. That's why it's crucial to ensure that the datasets used to train AI algorithms are diverse and representative. Imagine this: it's 3 a.m., and you're feeling overwhelmed with anxiety. You need someone to talk to, someone who will listen without judgment and offer support. In the past, you might have felt stuck, but now, with AI-powered chatbots, immediate mental health support is just a click away. These chatbots, available 24/7, provide a readily accessible outlet for individuals to express their feelings, manage stress, and seek guidance when traditional therapy might not be readily available or affordable. One of the most significant advantages of AI chatbots is their ability to bridge the accessibility gap in mental health care. In many parts of the world, access to mental health professionals is limited, waiting lists are long, and the costs can be prohibitive. AI chatbots offer a cost-effective and readily available alternative, ensuring that individuals can access support whenever and wherever they need it. These chatbots are designed to engage in natural, human-like conversations, offering empathy, guidance, and evidence-based coping strategies. They can help individuals identify negative thought patterns, practice mindfulness techniques, and develop personalized strategies for managing their mental health. While AI chatbots are not meant to replace human therapists, they serve as a valuable tool for providing immediate support and bridging the gap between individuals and traditional mental health services. They offer a safe and confidential space to talk, process emotions, and develop coping mechanisms, ensuring that no one has to face their mental health challenges alone. From AI-powered diagnostic tools that can detect subtle signs of mental health conditions to virtual reality therapy that transports individuals to immersive healing environments, we've covered a lot of ground in this exploration of AI and mental health. Remember, the goal here is not to present a utopian vision of the future or to sound alarm bells. Instead, the aim is to engage in a balanced and informed discussion about the potential benefits and challenges of integrating AI into mental health care. As with any transformative technology, it's crucial to proceed with caution, ensuring that ethical considerations are at the forefront of development and implementation. The future of AI in mental health is being written right now, and it's up to all of us, researchers, clinicians, policymakers, and individuals, to shape this future responsibly. By embracing innovation while remaining mindful of the ethical implications, we can harness the power of AI to create a world where everyone has access to the mental health care they need and deserve. Thank you so much for watching. Feel free to like, comment, and subscribe for more exciting news in the world of AI.